Three U.S. bishops have issued an important reminder as concerns grow over limited medical resources. Archbishops Joseph Naumann and Paul Coakley and Bishop Kevin Rhodes write in part, quote, "Foremost in our approach to limited resources is to always keep in mind the dignity of each person and our obligation to care for the sick and dying." Joining me now on Skype to talk about the Catholic and moral considerations surrounding this issue is Dr. Joseph Meaney, president of the National Catholic Bioethics Center. Dr. Meaney, welcome to the show. Thanks for joining us.
Hi, it's a great pleasure to be here.
So when it comes to administering medical care, what exactly does church teaching say?
Sure. I mean, Catholic healthcare has an enormous tradition, right? Because it goes back to the healing ministry of Christ. And it's really seen as a ministry of the church in solidarity to our poorest, most vulnerable brothers and sisters all around the world, Catholic or not. Catholic healthcare in America is enormous. You know, it's 20% of healthcare in America. And it's very beautiful to see how much good is done through healthcare. The Catholic vision is one of really taking care of our brothers and sisters.
Dr. Meaney, what should medical professionals keep in mind as they're caring for their patients?
Sure. I mean, it's such a crisis right now. And one of the terrible things about the COVID-19 disease is that people are fearful. They don't know if they have it, if they don't have it, if they should get tested or not. And there's a very strong kind of a fear factor that needs to be overcome. And knowing your doctor, being able to trust your doctor's advice is wonderful. It really helps to be in communion with someone.
Are you concerned at all that a scarcity of resources could possibly lead to discrimination against vulnerable segments of the population, people like the elderly, or maybe those with physical and intellectual challenges?
Yeah, that's certainly a big concern. Right now, we're looking at certain parts of the country, like New York City, where there's a huge influx of very seriously ill patients, and they're wondering whether they're going to have enough ventilators, whether they're going to have enough resources, enough ICU beds, et cetera, to take care of all these people, and how, if they do have to do triage, how is that going to be done? And it is so important that there is no discrimination against our most vulnerable brothers and sisters, particularly those who have disabilities or older citizens. I mean, the essential point that the church wants to remind everyone of is that we all have the same equal human dignity, and we shouldn't be discriminated against for non-clinical reasons.
Dr. Meaney, going back to that previous question that I just asked you, do you think there's anything that can be done to safeguard against it?
Yes, absolutely. So some of the protocols that are being proposed, the National Catholic Bioethics Center, we are really advising all different Catholic hospitals and other hospitals and health systems as well, that they should really use objective clinical criteria when they're trying to do triage. They should not be using, life years saved. They should not be looking at, the disabilities or the quality of life of people. They should just be looking, who can we save, and what is the best clinical decision that can be made for this patient. That is what we see as the right ethical approach, and certainly in conformity with Catholic teaching.
Well, Dr. Meaney, thank you so much for your time and, of course, your insight. We really appreciate it. Dr. Joseph Meaney, president of the National Catholic Bioethics Center. Thank you again.
Thank you so much, Tracy.